This is really topical. So global health is at the moment really in vogue, and last week on Monday the Lancet Commission reported its findings for the first time at the Royal Society of Medicine in England. And the report was over 2 years. For the first time we've sort of quantified the inequality of surgery access across the globe. So for example, the things they reported on were that out of the 7 billion population, 5 billion have very poor access to safe and affordable surgery and anaesthesia. And that means people that have, for example, a broken bone, an appendicitis, or may require a caesarean section, actually can't access the healthcare they need. It's estimated that a third of the population, actually die of a condition or an illness that can be treated potentially by a simple operation that we take for granted in the West, for example. So there are huge numbers there. We also estimate from the data that it would take about an extra 1 million surgeons or surgically trained staff to provide this. So I think the Commission report last week has to be one of the most important pieces of work that's happened in the last 100 years. I think the problem we have is that once the data is out there, the question is, what do we do about it? Now, some may just want to close their eyes, pretend the problem doesn't exist, for example, because it would take money and resources, there's no question. Therefore, if you want to be a cynic, you can avoid the entire question because it may require resources. If, however, you want to challenge that and deal with it, then you've got to offer some solutions about how do we as a workforce or as surgeons around the world actually impart that knowledge, number one, as you said earlier, but also how do we create that workforce to deliver those operations locally in any hospital around the world. And the areas that are of real concern were Sub-Saharan Africa, Asia and Southeast Asia. They're the areas that are really poorly, I suppose, supported by safe surgery. Using wearable devices, whichever you like, whether it's using augmented reality or virtual reality, and using a simple internet connection, you've got the two prerequisites of actually penetrating virtually the whole globe. Okay? That's the reason behind what we do. Hi, I'm Shafi Ahmed. I'm a consultant surgeon working at the Royal London and St Bartholomew's Hospital. I'm also an associate dean at the medical school at Bart's London, and I'm the co-director and founder of both Virtual Medics and Medical Realities. We're working in the augmented reality and virtual reality medical space.